Can you just kind of paint the picture of what it's like when it comes to labor in the healthcare sector? Obviously, COVID, it really stressed a lot of your employees. They had to work long hours. It was just a very stressful situation. When it comes to wages and demand, where are you at right now?
Well, certainly given the turnover rates, which means people coming and going, you basically have a free for all when it comes to what hospitals and physician groups have to pay their employees. So right now, the turnover rates are somewhere still near 20% for nurses. So imagine in a highly competitive market, you have to pay attention to wage, working conditions, hours, professional development. So wage clearly takes the cake when it comes to thinking about it. So I think all of the hospitals and all physician practice have to pay attention to wage, no question.
Yeah, you actually have a very busy urban hospital. I was actually lucky enough to be there when the first vaccines arrived at University Hospital, and there was just so much demand from the people in that community. I know how important your hospital is to that community. I also want to talk to you about the jobs report coming up. So as we mentioned last month in March, healthcare added 51,000 jobs, more than 20% of the gains. Do you see that trend continuing going forward?
Absolutely. My hospital in particular, but I know from looking at New Jersey Hospital Association data, knowing from my colleagues in Florida, that all of us still have a reasonably large vacancy rate, which right now we fill by having employees work overtime, having employees who normally work smaller schedules, work different schedules. So we don't have a situation where we don't have enough people doing the work. But what's happening is we're asking people to do different kind of work, more hours, because we have to offset the vacancies. So there will be a robust hiring foreseeable future. I would say is at least 3 years. The reason I say that is because what we witnessed coming out of the pandemic was an extraordinary commitment to workforce. So you've watched colleges and certificate programs add more slots. But as you can imagine, students need time to be in the classroom and then develop skills and then come out. So I foresee this being very robust. The other reason I think it's going to be robust is what the pandemic taught, at least academic medical centers, right? So in the United States, we have about 5,000 hospitals. There are only 200 academic medical centers. So imagine some of the biggest places in the country, some of the most sophisticated places in the country. We took care of the sickest of the sick. And over time, when you take care of extraordinarily sick people, you need more nurses, you need more physicians, you need more support staff. So when we think about the hiring, it's also a combination of how you have to add labor to be able to take care of these very, very sick people.
Yeah, again, I really want to highlight how important your hospital is to the Newark, New Jersey area, a very dense urban population that was hit very hard during the COVID pandemic. I also want to talk to you about another big macro trend, artificial intelligence or AI. How do you see it impacting your industry?
So I think it'll have a combination of things. AI probably has some limited utility in very complicated and high-end medical procedures. So imagine traumatic care, imagine transplantation. It has its limitations. But when you think about sort of the everyday basic care that can happen in a hospital, helping nurses with assessments, helping with dispensing medication, helping understand what's going on with patients and their ancillary studies, I think there's a huge opportunity. So I think it's going to be a bifurcated world. There are certain things that are going to be AI incompatible. And I think that's not going to be the major focus, because I think the opportunity really lies in this day-to-day activity that would benefit tremendously.
Right. So not the major focus, but you mentioned a 20% nursing turnover. Nurses are obviously the backbone of the healthcare system. Just very quickly, could AI possibly help with that?
It can. I think we have to understand there's some limitations. The nurse who gives a patient a medication hand to hand, I think that doesn't go away.
Right.
Helping do assessments, helping do vital sign checks, helping communicate with the medical teams. I think there really is a spot there where some of the work can be offloaded on nurses. And I think when that happens, nurses will feel more comfortable, or at least feel like they have more time in their job.
Got it.
And I think that will lead to job satisfaction.